Hi, my name is Kelvin Vu. I serve as the Chief Medical Officer for Open Door Community Health Centers. 2021 is Open Door's 50th anniversary celebration. As part of the celebration, we want to focus on the people that make Open Door so great. Each podcast episode will highlight an Open Door staff. It is an opportunity for us to learn more about them, their backgrounds, why they moved to the North Coast, why they joined Open Door, their dreams and goals. Won't you join us in learning more about our staff? On today's podcast, it is my great pleasure to chat with a person I've known for over 10 years. He actually was the one who interviewed me many years ago and convinced me to join Open Door. He has served in many roles at Open Door, including the site administrators for 3 different clinics. Since his retirement, he's been busy and currently serves on our board of directors. Jay Molofsky, welcome.
Hello, Kelvin. Hello, everybody. It's wonderful to be here.
Thanks for joining us, Jay. We have lots and lots to talk about. So let's start first with people who might not know you. Can you tell us a little bit about your family, Jay?
Well, my latest, I have a lot of family members here. First, I guess I can talk to you about our dog, Jean-Luc Picard. Shall we say, named after the wonderful Captain Picard. I guess Admiral Picard. He made it that far. And he's a lab mix who joined our family in March of 2020. He's our COVID dog. Quite a character, keeps me walking all the time. I'm trying to hit about 4 to 5 miles a day, and he's a wonderful dog to have to do so. And in addition to that, my daughter just this month, Kelvin, I know you take care of her, gave birth to twins. Isn't that
exciting.
Cool?
Twins. Very exciting. Yes, twins.
Yes, it's very wild. It's very, very wild thing. And she had a great birth in San Francisco. It was a higher risk pregnancy, but she did well. And she's out here now on the coast. So I got 2 new granddaughters to join our family as well. Got a lot of kids, a lot of grandkids, Kelvin. There's hope for you. 9 grandkids, 9 of them now. So things are going well in my life. That's a little bit about my family, I guess. Been married for a long time.
Well, then, with that in mind, with your family, then how did you come to the North Coast, Jay?
Well, I grew up in New York City, Kelvin, and I was born in Manhattan, and I actually grew up in Queens, not far from Shea Stadium. Jamaica is my home area, and when I was 19 years old, I was still living in New York at that time. I took a cross-country trip with some friends of mine, and we traveled from New York. We went up into Canada. We took Highway 1 across Canada, all the way across, camped the whole way in the summertime. And we made it to British Columbia, and we started down the Pacific Northwest coast, which I had never been to. I remember when I saw the Pacific Ocean, oh my God, it's one of those scenes you get down on your knees and kiss the sand. So amazing. Quite different than the Atlantic. Anyway, we discovered on our trip Prairie Creek National Park. And I just knew I'd be back someday. For me, it's I like to think of it as a spiritual home. It really does call out to me. And so finally, I made it back some 30 years later, and joy to do so in 2002 is when we made it back here.
And Jay, I think you probably know this too. That's actually how I found out about Humboldt as well, is that my wife and I went camping in Prairie Creek. And so for those who are joining us, Jay and I have quite a few things in common. Our love for HBO, and then how we came to the North Coast, which you'll find more about with Jay. So Jay, then, so we talk about your family. We talk about how you came to the North Coast. What about Open Door? How did you join Open Door, or if you can remember what your first day at Open Door was like?
Yeah, well, my spouse, Dorothy, came here with me, and I had managed community health centers in Austin, Texas for several years before I came here. I had over a 20-year career in Austin. And it was a good time for me to be able to move out of Austin for a number of reasons. Our family was gone, and I wanted to get out to the Northwest. So we came out here, and I really had no plans coming out here. But my wife is a registered nurse, and she quickly found employment with the county. And one day she came home and she said, "Hey, the community health center's Open Door are looking for an HIV administrator or director. I'm not quite sure what it is, but maybe it would be something you're interested in doing." Well, I had managed HIV clinical services in Austin, and I thought to myself, "Ooh, it's wonderful walking the redwoods every day. I love it. But this would really be cool to see what the community health centers is and to help form the program." So I was hired in 2002, and incidentally, I retired in 2019, where I joined the board of directors in 2019. And I guess I was hired to administratively direct our newly formed HIV program, Kelvin. And what it was really, it was to write and manage our first Ryan White grant. It's a federal HRSA grant, it's the Ryan White grants. And so I was able to interview through the job. I remember my interview very clearly. People like David Horowitz on the team, Cheyenne was on the team as well. And I was hired, and I began work at North Country Clinic. I was stationed upstairs in those tiny little cubicles. I was working with a grant planner who Open Door had hired the year before to start to plan the grant that I was scheduled to write and bring the program up. And I reported to a wonderful woman named Carolyn Jones. I don't know how many of the folks listening to this remember Carolyn Jones. She was Cheyenne's assistant, but really in many ways a co-director with Cheyenne at Open Door in those days. Really, life couldn't be better for me. It's great working up at North Country and pulling together a program and writing the grant and then bringing the staff on. And of course, we were treating HIV in those days. We had about 80 to 90 patients, but it was kind of spread out. And the whole idea of being able to get a federal grant was, first of all, to secure dollars for the expensive treatment plan, but it was also to provide standards across the board, federal standards that we can institute and implement and hire staff like registered nurses to help work with our providers on the program. So that was it. That was my first few weeks at Open Door, actually probably about my first year's worth.
Yeah, and our HIV programs now, both in Humboldt and Del Norte counties, are very strong. We serve a lot of our patients. So thanks to your hard work from the beginning there as well. You know, speaking of interview, let's talk about healthcare and how we came to know each other, Jay.
Yes.
So I don't know if you remember my interview with you at North Country Clinic.
Yes.
And upstairs as well, eons ago, and how you ordered those delicious sandwiches for lunch for me that day. You roll out the red carpet, say, "Oh, come join Open Door. This is what we can offer you." Remember that? You
must have been very impressed with those sandwiches, Kelvin. Your favorite, I know. Yes, sorry. Yes, I do remember that. And what was so cool about interviewing you, that was 2011. And also in that same time period, we brought on Eloy Hoopman. Do you remember that as well? Yes.
Yep.
Eloy joined the staff as well. You were very unique to me because you were all about community health back then as well as today, Kelvin. And it was very, very unique. You spoke to me about your love of family medicine, but you also spoke about community health and public health. And you wanted to be able to work outside the clinics for some of your time, on wherever that might take you. Could take you in a number of directions. And one of the directions that I love that it took you in was that when Open Door took over homeless services from Wendy Ring's group,
Yep, on the mobile van.
2012, right? You were the first. I mean, I'm taking my stint on the van, and you were, and there you were out into the van and into the community. Of course, with the medical society and the coming years up and residency programs, and we can talk about all that as we move on. You have continued with a love and an interest in more than just one set of clinic, one focus of clinics, the Suboxone program. We could go on and on and on. Your leadership over at Redwood, your leadership over in Fortuna, your leadership now as medical director. It's a real looking out and forward, in many ways, very creative and a starter of innovative projects. Anyway, you impressed me as all that from our first interview. It's very exciting for me to be able to bring you on, or at least to be part of that. I didn't personally do it, but yeah.
Well, it's mainly the sandwiches that got me, Jay. Those famous sandwiches that you got that sold me over to join Open Door.
Yes.
And we've had many conversations over the year, and one of the things I enjoy about us is especially with your many years in working the community health centers is your viewpoint in healthcare. And now more than ever, a lot of these topics are more relevant. Can you share with us your perspective of where we were and where we are now?
Yeah, sure. I guess, let me think on. Well, I guess I would just say that what I've always loved about Open Door and why I was so excited to join the board when I left Open Door in 2019 is because, for me, many of the innovative programs that we've created over my 16 and a half years working for Open Door, they're all linked to a common theme. And for me, that theme was really increasing access to quality care for our community and for all of our community by working collaboratively with our staff and the community. So when I think about that, I can't help but really prioritize the whole concept of social justice, Kelvin, and its relationship to healthcare. And if you don't, if you forgive me for a minute, I would just like to, give you my viewpoint on it. And when I think about social justice, to me, it's a very clear concept that everyone deserves equal rights and everyone deserves equal opportunities. And certainly that includes the right to good health. And yet today, as in the past, there are inequities in health. And I think they're avoidable, they're unnecessary, and they're unjust. And, the inequities, to me, they're the results of policies, the results of practices and it creates an unequal distribution of money and of power and of resources. And it's based upon race and class and gender. Places, I'm sure there are a multitude of other factors. So to me, to assure that everyone has the opportunity to attain their highest level of health, we need to address the social determinants of health, and we have to address equity. And I think that Open Door does that. So, you can start with just FQHC services, Kelvin, and we are an FQHC. We became an FQHC, when was it, 2000 or 1999, 2000, somewhere around that. So 20 years ago. And what are they really about? What is an FQHC about? Federally qualified health centers. Well, no one is denied access to care due to an inability to pay. Healthcare is a right. It's not a privilege. There's a full array of services at our clinic sites. What do I mean by full array of services? I mean, there's child health, there's women's health, there's adult health, there's behavioral health, there's integrative and integrated care that it links patients to behavioralists, to social workers, to case managers, to teams to manage their care. So the teams, you got RNs, you got MAs, you have providers, you have social workers, you even can bring in behavioralists, nutritionists, but they're all working with patients together. And the key to FQHCs is that patient relationships are what is valued. So, I mean, to me, that's a huge commitment Open Door has always had to, again, increasing access to care for everybody in our community, becoming an FQHC. So then you can start looking at us, and, you can start with, at Open Door, whether it be family planning. And of course, many of the folks at Open Door were behind Family Pact originally in California a number of years ago to increase access to care for family planning. Whether we're talking about women's health services, HIV services, homeless services, which you know so much about, having been the leader in our homeless service program. Several years ago, not that long ago, though, what was it, maybe 12 years ago, we began trans services at Open Door. David Horowitz did that at HODC. He had 6 patients initially. What do we have now? Well over 200 patients. And that spread through word of mouth. Teen services, we paid teen ambassadors to begin this pretty unique and well-known teen service program. OB services. I like to think about our substance use programs, which have always been part of Open Door, substance abuse counselors, the Suboxone program, which again, you helped form at Open Door, and you've seen the successes of that program. For a long time, Open Door did needle exchange here, and I mean thousands of needles were being exchanged every single month. We dropped that program here, and now we have community organizations which are taking it up. But we have, this commitment to Narcan. So continued support for substance use at Open Door. Just the creation of our member services unit. Very, very unique in community health centers to have a separate member services unit that does the things that our member services unit does. Bringing on patient advisors to our clinics, clinic process improvement teams, doing intensive care management program for patients. Our commitment to state-of-the-art health centers, this tremendous thing that we've done, Del Norte, Eureka, Fortuna. It will continue now with the Arcata clinic. State-of-the-art health centers, very unique. There's very strong commitment to all of our patients in the community. It just goes on and on and on. Billing, facilities, IT support, first rate. And I guess I'd also say to you, the whole idea of having administrators and providers working together to help shape the policies of this organization, working together to do so, is extremely unique and innovative. And to me, at its core, the organization has always been committed to leverage, if you want to call it that word, the healthcare playing field for all. And so I think we're really part of this social justice and healthcare viewpoint. And Kelvin, we can go on and on and on because it's really unique. Because how shall I say it to you? Not only do we work in terms of programs, but we work also in terms of having, shall I say, rules of engagement, which clinics develop with their teams. So the whole idea of having respect and trust in your commitment to each other as staff members is a big deal. Just having that out there and understanding that's kind of a rule we live by. Or to resolve communication problems with each other as quickly as possible. This whole push for active listening. To do so is a huge deal. To build consensus, to think before we speak. That language can offend others. So as a team, we're going to work to build consensus, not to tear it down. To have no tolerance for blaming other people. to don't make assumptions about other people. These are all core things which I worked with staff, and staff taught me to develop at our clinic sites. To take risks, Kelvin. I mean, they're calculated risks, but we take risks. You know, this whole latest adventure, even in terms of what the mandate that we are going to have a vaccinated staff at Open Door, is a risk we're taking, but it's again a dedication to what Open Door is about, to the science and to healthcare. So the whole idea is you really can't have growth without taking risks. So I guess I would stop there, but I see that is a little bit of what we're about, where we came from, what we have continued, and what makes this organization such a unique, wonderful place to be part of.
Preach, Jay, preach. That was a very
preach,
succinct. Eh? You did a very succinct overview of the evolution of healthcare at Open Door in the last 20 years, and it was needed too, from your perspective. You know, coming from Austin, Texas, to now out to California, you basically hit it all on the right points, right? It's about access to care for our patients in this day and age. What was true 20 years ago is now true still today. You talked about how we should collaborate and have team-based approaches into all the things we do, and to provide or to emphasize social justice, right? With all the services that we provide. You mentioned homeless health, you mentioned OB services, teen care, our trans services, our MAT, our HIV. That right there, you basically went down memory lane with all of the things that we have been trying to do, and the patient is at the center of all the things that we do in some of the innovative programs that we talked about. So that was great. I could just like a lot of our listeners, we can probably listen to you for hours on end about your perspective on healthcare. And you know what, you mentioned that, like, you know, of all the good things we do, there's still a lot of room for improvement, right, Jay? So now looking back, then, you know, we talk about philosophical and big picture. If you can just pinpoint for us, you know, some of your memories that stand out to you when you've been working with Open Door, whether with certain group of people or certain programs, can you share with us some of those memories of yours that you liked?
Well, some of the interesting memories are actually around patients in many different instances. I can share some of them with you, which the staff who were there will smile if they're listening to this and hear it. And I think it's been true at all of our clinics in some regards. So when I was at a Humboldt Open Door clinic in Arcata, we were very close to the square. And I was there from 2004, actually administratively managing the clinic, until 2012. So I was there for a long time. I was there for 8 years. And because there were a lot of interesting things that went on there. Now that I'm speaking to you about it, one of them is that when we took over homeless services, which happened really at my last year there, instead of having the homeless van come to Arcata, we made a deal with North Country and with HODC that they would actually see homeless patients and triage them into the day-to-day operations. That was kind of a fun thing to work on with the head nurses at both clinics, and actually see it come to fruition and save the van from, at that point in time. I know things have changed presently, but at that point in time, there wasn't that overriding need to go to a place. The van could be further set out at places where the van was needed more, where there was, if the homeless population was being taken care of medically through other means, which we did so in Arcata. But one of the interesting things I wanted to talk to you about was, because we were so near the van, and it was a very we'd have a lot of people passing through town, through the square rather. We had several people who were not necessarily our patients who would come through the doors. Every morning I would arrive early and I would go around the clinic, and there'd be, of course, a lot of folks sleeping at every doorway. And I would gently wake them up and let them know, hey, we're a medical clinic. We're about to have a lot of folks here. And I'm sorry, I need you to move on. And frequently we would even have food from the food pantry we'd bring out and just hand to folks. And people understood that. But there was rarely a day that went by, and certainly not a week that went by, where there weren't several interactions that were somewhat troubling and also somewhat funny with patients at the front desk. And because I was the administrator, we put a whole team together, which we called a crisis intervention team, which included the behavioralist, myself. Generally, I had some of the guys from the back. The male lab team from the back would also join us if I needed support and health. One day, we had Goat Man come to the clinic. Goat Man was pretty well known in the community, and he came with this huge goat. Just came in through the front door, and he had a video guy with him, and he said, "I'm here to take video. I have my service goat, and I am insisting on being cared for at the clinic." So, for a while, we tried to talk sense with this guy, but he was clearly not in the mood. And his video guy was talking about prejudice and how we wouldn't let this guy in with his goat. And it was a gigantic goat. It was not. And eventually, unfortunately, in this case, we had to call the police. The police came and we had to lock down the clinic. And there were several scenes like that we worked on with patients we developed policies and procedures, and we brought on patient advisors to help us, literally from a patient's perspective, navigate through how to work with individuals wherever possible. But also from that, we developed a policy at Open Door on what exactly was a service animal.
It was not a service goat then? It did not qualify as a service goat?
Couldn't be goats. Couldn't be parrots on people's shoulders flying around the clinic as well.
A service snake, maybe.
So that was an interesting experience. I don't know whether that's quite where you wanted to go, but it was unique for me. There were a lot of very cool experiences at homelessness, I would also say, Kelvin, and it's the interesting thing to me about it was, every day I would go out to the van, wherever the van was, and I not only met with the staff for a few minutes, but I always sat and spoke with several of our patients just waiting in different areas. And the stories were really interesting and very different than the way the press portrays it. So frequently they were, people like yourself and me, and for a number of odd reasons, not so odd reasons, actually. Many of them related to social justice issues, found themselves out on the street. And in talking to people and what they wanted and what we needed, it was really fun to have a whole team of dedicated people there, yourself included, and wonderful individuals who would meet with people literally right there at their point of need. And this included our social workers and our behavioralists who went out, and our nursing team that did the triage every single morning with people and really dedicated to do whatever the heck it took, really whatever it took, to ensure these people received equal access to the great care that they deserved. And it was a very wonderful experience for me. Just as a side note, I managed homeless services in Austin, and I also felt that way in Austin. So again, I think that when you actually just sit down and you work with people and talk with people, you get a whole other perspective than frequently the way things are presented in the media on the way things are. It was pretty unique. A lot of instances like that working with patients.
Yeah. And it reminds us too, Jay, of our humanity, right? We are all connected. We all feel pain. We all feel joy. We all have our life challenges, and some of us got lucky, and others are not so fortunate. But healthcare is what's going to connect us. That, like you mentioned before, that healthcare is a right and not a privilege. And these memories that you brought up, from Goatman to our patients on the mobile van, it reminds us that we all link somehow. And as human beings, the least we can do is care for each other, especially when we are ill and sick.
Yeah, one other thing I just wanted to point out that I also found very unique and was a lot of fun to work with is the concept of behavioralists and providers working closely together. At some of our sites, the idea that a behavioralist can go in first with a patient, or a behavioralist can look at who's on the provider's schedule that day and pick out, these are the ones I want to speak to. Or what happened, of course, in homeless care was behavioralists just spoke to everybody, even to say, hi, I just want to introduce myself, and hey, you need me, I'm here. But this whole link that the healthcare is not entirely your job, Kelvin. It could also be the behavioralist's job. It could be the RN's job, and you do a wonderful job of delegating out the services to your team, which is why you're one of the reasons you're so popular. People really want to work with you, and it's a wonderful thing to watch that in action when it really happens, because people have different needs. And at different times in their life they do. So this whole utilization of team concept at Open Door, and I know that's something that we still need to develop further at Open Door, that it's just really starting to take shape, and it's always taking new shapes. But I love the idea that we take stabs at it every day.
And exactly. And then you brought up back to that collaboration, right? And then you actually brought up 2 points. One is the collaboration where we're all team members. Mm-hmm. I, as a physician, is a valuable team member, but so is my behaviorist, so is my case manager, so is my RN, so is my MA, so is my lab person. And the second thing that you mentioned is behavioral health. This pandemic has basically revealed this gap, this discrepancy, this whole this in our psyche, and in that we all need help. And then medical health involves dental health, involves like behavioral health. So yeah, this is what we need to do, and this is what we need to get better at. So then, Jay, this is we're celebrating our 50th anniversary podcast. We're hoping that we're looking forward to the next 50 years. Now, looking at your experience and what you have gathered from this, what do you foresee in healthcare in the next 5, 10, 50 years?
Yeah, okay. I guess for me, just talking about Open Door directly, I was really happy at the very end of my career to be able to work with the residency programs. That was a dream I didn't know whether Open Door would ever actually do. In many places, as an example, in Austin, we had residency programs, pediatric and internal medicine at the community health centers over there. But over here, I didn't know whether we would ever get that far and be able to work collaboratively and form something with the hospital to make it happen. Because for us, living out here and the isolation and for the rural aspects of life out here, it's been so difficult to be able to attract providers who are willing to stay. And we have this aging provider population that have been here for a number of years. And we need to, and certainly now with the changes happening at HSU, I think our community is only going to grow as HSU probably triples its enrollment, becoming the tech school. And, as the rest of California, probably, my gosh, we're not in great shape anywhere south of here. When we become the new California in many ways, we need to be able to attract providers to keep us going. So for me, the future here it lies in being able to kind of grow our own and come up with unique opportunities to make this place really attractive for providers. And I know that's part of the plan in bringing on state-of-the-art health centers, because providers want to work in a state-of-the-art. It's good. It's a good attraction tool. But on top of that is a wonderful thing to bring on our residency program. So we have 18 now in our family medicine. We have this nurse practitioner, a PA residency program, and about half of the folks there have stayed with us through all the years and continue to. We'll see how this residency program for family medicine, how many will stay. I would hope that we can get a number of family medicine residents who will stay. And these are young individuals for the most part who can make their careers here. And we need to have an environment where we can grow with people. And be able to have providers here to care for this community. So I'm very excited about that. I think that's a great direction for Open Door. I know it's not always, it's a difficult direction because you have to work collaboratively with so many different groups and with the hospital, and our purposes and St. Joe's purposes are not always in complete sync with each other. And yet it's a challenging project and one that we need to move forward on. So, for me, I would just focus on there for a start, because that's an immediate future for us and where we go. And so I don't know. What are you thinking?
Oh, that was as a learning organization, right? Yeah. As you sit on the board of directors with us, yeah. As a learning organization, we emphasize teaching and passing our knowledge and training the future generation. And you hit it right there. Besides our APC residency that started in 2016, or family medicine residency that started 3 years ago. We also have our long-standing dental residency that's been around for 10 years.
Thank you.
As well. And so, yeah, it's about training, growing our own, and there are growing pains. You experience that as much as the next person on how to get other organizations to align in our mission. But I truly believe, just like you, that in the end, it's worth it, because if we don't, there will be no one there to take care of you, to take care of me, to take care of my kids. And so it's a very important endeavor, and it's part of our mission. Hey, so Jay, as we wrap up on our podcast, because you and I can go on for hours and hours talking about life, two things before we get to that. I mentioned in the beginning, Jay is an avid reader and also an avid watcher of TV shows and streaming stuff. So what are you watching, or what are you reading nowadays? What's keeping you up at night to at least for entertainment value?
Okay, couple of books I've read recently that I really recommend to you. I don't know if you've read this one yet. Have you read Trevor Noah's Born a Crime?
Yeah. I have. Yeah. And also listen to his or watch his comedy special as well too.
Right. That was first class. I really love that book. Really an eye opener, and he writes in such a very real style. He doesn't hold back. He doesn't hold back on his life, what he was about, and where he's grown and where he's at. And it's just a great piece of writing. So I recommend it highly for those people checking it out. Trevor Noah, and it's Born a Crime. I do read a ton, Kelvin. I read just book after book after book. So some of the stuff I'm reading right now, there's a new novel. I don't know if you've read this novel by Jess Walter. It's called Beautiful Ruins. You might.
I have not. I haven't got the chance.
I may send it to you. It's pretty hot. This is a novel. I read quite a bit of nonfiction as well. Mark Bittman has written a book on food and on the history of food right now. He used to be he still actually does write for the New York Times in their cooking section, but it's not a cookbook. So I would recommend people check out Mark Bittman. As far as TV, oh my gosh, Kelvin, do you get Hulu? Oh my God. Okay. So, what can I tell you? The Handmaid, fantastic.
Too dark right now for that, Jay. Too
dark. Very dark.
Too dark for that.
Very dark. Have you been watching any of Nicole? Oh my gosh, I'm such a Nicole Kidman fan. I could go on and on and on about Nicole. She got 9 private lives now going there as well. That's very hot, very entertaining stuff for me. So yeah, I'm watching, tons of stuff. Spike Lee's show on New York on HBO is very, very good.
Yeah, the 9/11 documentary, right?
Yes, yeah, that's a few. I think they're on episode 2, maybe moving to 3 now. So recommend all that for you. Yes, hot stuff.
Yeah, no, great book suggestions and great TV suggestions. My only thing though, given the pandemic, I have avoided anything that's dark and drama. I only watch comedy or actions. And so I just watched, like things that just take off. So last night I watched The Suicide Squad.
My God, that's
it's on HBO. It's actually quite entertaining. You kind of, I'm into superhero genre right now because we all need a superhero in our lives, just to deal with the current thing.
Yeah.
And Jay,
I would recommend The Mandalorian for anyone. Oh my gosh, that's really my favorite. One of my favorite shows. Of course, I'm crazy about Baby Yoda.
Yes, on Disney Plus, right?
Yes.
So, as we have people joining us and people near retirement, I'm curious if you can share 2 things. First one is one piece of advice you want to share someone who is beginning their career or joining Open Door. And then the second thing is one piece of wisdom to someone like me who's at the end of their career, who's going to retire soon. Any of the advice for those 2 individuals?
Yeah. Well, I guess for a new person, I would tell folks, for me, it was always saying yes. Say yes to any opportunities. Say yes to opportunities that come your way. And, I would suggest to people to just move forward with the twists and turns of those opportunities. But most importantly, I would recommend for folks to take action to make this place a better place wherever life leads you. This whole concept of repairing a broken world, taking the broken pieces of the world and kind of putting them together in some fashion to make it better, I think is pretty critical in a career or in life, just as a philosophy of life. Yes to opportunities. Let the path take you where it's going to take you as well. Make it better. So that's kind of how I feel about things. And I think we'd have a better world if we did that. Now, one piece of wisdom to someone at the end of their career or someone who is retiring, or for me, I can discuss it as being a little bit of what retirement has been like for me. So, I thought I really got it working all those. I worked 40 years in healthcare, and Kelvin, before that, I worked 5 years as a park ranger. So I've been working for a very long time, and I thought I really, oh my gosh, I had it right on life, and I had all these contacts. I get tons of emails every day, and I would be so busy every day. And then, of course, when you retire, you kind of fall off the map. It was kind of unique to me and interesting to me to get 1 or 2 emails a day. A pleasure in many ways, but quite different. And then I started spending a lot of time just enjoying things, going for long walks with the dog, as I mentioned, and noticing things I hadn't noticed before. It may sound kind of oddbally, but taking a look at we have near us these paper wasp nests that are just growing in trees. Huge nests of wasps, and they get it from the bark of trees. I had a hawk, red-tailed hawk, land on the fence post opposite me, actually land in front of me, which was kind of shocking with the dog, and just taking the time to explore and identifying plants and trees at all the parks that I didn't know about and their medicinal purposes. And I discovered, the famous line from Game of Thrones, Kelvin, which we spent quite a bit of time talking about. What a show, eh? Is this whole concept of you're able to retire and you're able to go with it. And I would just say, and keep this in your mind as you're about ready to, that you know nothing, Jon Snow. it's a whole wide world out there. There's many different ways to explore it and to open up your mind to it when you leave and drop this. I'm at the top of my game and I'm, et cetera, et cetera. Drop it and move on with the new experiences and the joy of life. And we live in such, as you just pointed it out, such difficult times with COVID, and people are so really down right now. And we've seen so much death, depression everywhere that it's difficult to do it, but I like to keep humble about it. I say it a lot during my day. Gosh, Jay, you know nothing, Jon Snow, as something else reveals itself to me. So I guess that's what I would tell you at this point, Kelvin.
Great advice there. Yeah, you know nothing, Jon Snow. It ranks up there as winter is coming as well, too.
Yes,
that's winter is coming.
Yes, it is coming.
Yes.
Again.
Well, Jay, as we're coming into our interview here, our podcast discussion, I want to say thank you for coming on, and I also want to show my gratitude, my appreciation for you. We've known each other for a long time. You've always have been mission oriented when we work together. Yeah. You have been patient centered. It's all about the patients in healthcare. That's what is important, right? That's what draws us together, is how do we improve the life of our patients. You've also been very collaborative in the way that we build our pods, how we interact with our fellow team members, and it's about collaborating for the greater good in the end. And so I'm glad to know you as a friend. I'm glad to know you as a colleague, and now as a board member. And I'm glad that you and I were able to share this just time together. It's just chit chatting about life and healthcare, Jay.
Okay. Really appreciate it, Kelvin. Appreciate you. I'm glad you're leading the organization onward medically. Do your thing, Kelvin. We're only going up with you.
Well, thank you to Jay for a great conversation. We hope you enjoy our podcast. Yeah. We will see you next time for another entertaining and insightful chat with our Open Door staff.